Welcome to Breit Guide, where we simplify Medicare. I'm your host, Megan, with Breitenfeld Group. If you are looking for clarity and confidence when it comes to Medicare, you're in the right place. This is Breit Guide, and let's get into it. Hello there. Welcome back to the Breit Guide Podcast. I'm your host, Megan, and I am very glad you're here today. Whether it's your first time, whether you are following us, and this is your several time watching our podcast, as always, we appreciate it. I do work for the team here at Breitenfeld Group, and if you haven't heard of us, we are, many of our offices are based off of Minnesota. We have one office in Wisconsin as well, and what part of my team does is travel kind of around throughout the state and talk about Medicare, just Medicare as a whole. We try to simplify it for others. And this podcast kind of allows us to deep dive into some of those really important topics. And today we're going to talk about Medicare Supplement plans, or many people call them a Medigap plan. And before we dive into it, I do want to disclose that, really this podcast here and what we talk about today is for educational purposes only. I'm not here to recommend a specific plan or talk you into a specific option. It's just my job to kind of deep dive into some of these topics here, and it just happens to be about Medigap plans or Medicare Supplement plans. So if that is not part of your journey yet, you might want to hang with me to the end of this podcast, because although we talk a lot about Medicare because it's very important, we also kind of give some non-Medicare tips towards the end of our podcast. So hang with me, especially if you are a rice lover. I got a random tip that I heard the other day that I wanted to share with you. But first, let's dive into a Medigap plan. So what is Medigap, Medicare Supplement? And so Medigap plans are through private health insurance, and they are not in place of Medicare or original Medicare. Original Medicare is your Part A hospital, your Part B medical. They are not in place of it. Instead, they help fill in some of those gaps, some of those extra costs, such as in coinsurance or deductibles or copays that may occur to you. And so, like I said, the main point is they are not instead of original Medicare. You still have to have your Medicare Part A and Part B to purchase or to enroll into a Medigap plan. But they kind of go hand in hand, and they kind of bridge that gap of original Medicare and some of those costs, like I said, that you may incur. Also, these plans are standardized plans, meaning you could have one carrier offer Special Plan G, and you could have another carrier that offers Special Plan G, and they have to have those same benefits within the plan options. The biggest thing is that they can do is they can have different premiums. So you might see different carriers have different premiums, but the benefits have to be the same across companies. So that's just a few key points with a Medigap plan. So how do Medigap plans work? And I'm just going to make this as simple as I can because, that's what we do here. But Medicare is going to be your primary payer. So when you are on Medicare and you are on a Medigap plan, you have two cards. You have your Medicare card, your Part A and Part B, and you have your Medigap plan. And so when you utilize it, when you go to the hospital or you go to a doctor, you're going to want to show them your Medicare card as well as your Medigap card. Medicare will pay its portion of it, and then your Medigap plan will come pay their portion of it depending on what plan you choose. Generally, the higher the premium in a Medigap plan that you choose, the more coverage you are going to get. Medicare covers 80% of that bill. Some Medigap plans can completely cover basically that full 20% of your costs. But some Medigap plans are lower in premium, and you might still have a copay, or you might still, have a deductible or something like that in there. But That just depends on what kind of Medigap plan you choose. Another characteristic of a Medigap plan is they do not go by network. You don't have to worry as much about networks. Any facility in your state, and even traveling out of state, that accepts Medicare is going to accept your Medigap plan. And in my seminars, I'll say they accept your Medigap plan with loving arms, right? But they will accept your Medigap plan as well. So if they accept Medicare, they're going to accept your Medigap plan. You don't have to worry about network. Another important thing to note with a Medigap plan, it is a health plan only and does not include prescription drug coverage. So if you choose a Medigap option or Medicare Supplement option, you most likely will also want to look into purchasing a standalone Part D drug plan. So again, you have your Medicare card, your Medigap card when you are going into the hospital or doctor, and then you would have a separate card for when you pick up your prescriptions at a pharmacy. Medigap plans are also guaranteed renewable. So as long as you are paying your premium each month, that plan is guaranteed renewable. Of course, every year those premiums can change, but what you have built in your plan is guaranteed renewable, like I said, as long as you are paying your premium each month. Also, another important thing to note is they do not have added benefits such as dental, vision, hearing, anything like that. Medicare does not cover those added benefits. Therefore, a Medigap plan will not cover that either. So that's kind of, sometimes people have that misconception that you have those benefits built into a Medigap plan. There's certain other plans that might have benefits like that built into their plans, but a Medigap plan is health coverage only. So again, kind of going back to just the different coverages, you would have your Medicare card, you have your Medigap card, you would have your Part D prescription drug plan and a card for that. And then if things that were important to you, such as dental, vision, hearing, anything like that, you might want to look into a separate policy for those benefits to be covered. Another important characteristic about a Medigap plan is when you are new to Medicare, whether that's when you're turning 65 or if you're leaving employer coverage past 65, whenever you are new to Medicare, you can choose whatever plan, whatever kind of Medigap plan that you want, if that is the route you want to go with. It doesn't matter if you have health issues or not. You can choose whatever plan you want. Now, if you are on Medicare already, they have this period of time. It's from October 15th through December 7th. We call it the annual open enrollment period, but you have that time to be able to change your coverage to start that next year. So to start January 1st of that next year. Now, the Medigap options, their premiums and so forth can change. If you ever wanted to go off of a Medigap plan onto a different kind of Medigap plan, you would be subjected to health questions or what they call as underwriting. So if you want to go from one Medigap plan to the other plan, you typically will have to go through the underwriting process first. And based off of certain carriers, some they might look at your health history anywhere from 3 to 5 years. It kind of just varies depending on what plan and what carrier that you choose. So to kind of all tie this in to a Medigap or Medicare Supplement plan, who might it be a good fit for, right? So I would say a Medigap plan would be a good fit for someone who wants more predictable approach to their healthcare costs. Again, you're going to pay a premium, and depending on what plan, you might experience really no copays or out-of-pocket costs. You might just be able to budget for that premium and not have to worry about a copay or anything like that, again, depending on what plan you choose. But if you want some of those more predictable healthcare costs, a Medigap plan might be a more suitable option for you. Also, it might be a good fit for someone who wants that flexibility with providers and hospitals. They don't want to worry about network. If you're traveling, I'm from Minnesota, so if you are one of those lucky people that get to go down south, or what we call snowbird during the winter time, you might like that flexibility that you can go to any facility that accepts Medicare and you don't have to worry about networks. Also, someone who might consider a Medigap option would maybe be someone who's okay with a monthly premium in exchange, or a higher monthly premium in exchange for more of that comprehensive coverage. So again, there's a peace of mind that people may like in a Medigap option of budgeting for that premium, which can be higher, can be lower, just depending on what plan you choose, but then not having to worry about when you use the plan of kind of what those out-of-pocket charges are going to be. So those are some of the characteristics that you might consider when looking at a Medigap option. So kind of to wrap this all up, tie it all together, Medigap is really designed to come alongside original Medicare. It's not in replace of it. It is health plan only, so it does not come with prescription drug coverage. It also does not come with added benefits of dental, vision, hearing, things like that. And just depending on the structure you choose, it does have that coverage when traveling, and the range and premium can really vary per plan, per option that you choose, and per carrier. So as always, when we sit down with people who are aging into Medicare or who are looking at these options, the right choice really depends on your individual needs. Sometimes a spouse might go with one spouse might go with a Medigap plan and the other spouse might choose a total different type plan. But it really comes down to what your needs are. Those questions are, do you travel? What does your budget look like? What is your hospital? What does your network look like? Just some of those key things that are important to you. And again, it's very individualized. You might be on a total different plan than someone you have coffee with or your neighbor next door, and that is okay. We always say here at Breit Guide Group, our job is for you to know what you have and why, for you to understand your plan, how it works, whatever plan you may choose based off of the information you receive and what you find most suitable for you. So that's kind of our little bit of overview, deep diving a little bit further into Medigap. And so, yeah, thanks for joining me for that. And if you stuck around with me so far and you're like, okay, I didn't care about that, or maybe I did, but I also am a rice lover. So I have personally not tried this, but just the other day I was talking to a friend, and I have 4 kids. And so I do make a fair amount of rice. Oftentimes we'll even mix it with our burger as like a filler for them because they eat so much food. So I do make a lot of rice, and I tend to make an overabundance of rice. I do that with rice and noodles. And I had a friend tell me that, when they save their rice, because often in the refrigerator it can get kind of crunchy or hard and it's not nearly as enjoyable, that then when they go to heat it up in a microwave or something like that, they stick an ice cube on top of their rice. So then when it's heating up, it almost creates this steam, which makes the rice more fluffy and soft again. So I have not tried it. If you have tried it and this has just been a hidden gem of yours, please share it with others. Comment below. I'm excited to try it because, like I said, rice the next day is usually never as enjoyable, but I always seem to have plenty of it. So there's my non-Medicare related tidbit. So if you are a rice lover, let me know what your thoughts are, or if you tried this, or if it's worked for you, but I'm definitely going to give it a whirl. So thank you for joining me today. As always, we appreciate it. Feel free, we are on Facebook. Feel free to follow our page to stay kind of up to date with Medicare tidbits and things, just different kind of exciting things happening in the marketplace and all those things. And again, we try to have fun along the way because that's just who we are and what we do. So thank you for joining. Like and subscribe to this podcast if you don't want to miss an episode. And hopefully we will see you next time for another fun Medicare and non-Medicare related topic. So take care.
Thank you for joining us today. And remember, you're not navigating Medicare alone. At Breit Guide Group, our entire team is here to support you, answer your questions, and help you feel confident in every Medicare decision you make. If you found today's episode helpful, don't forget to like this video and subscribe to the channel so you never miss an episode of Breit Guide. Thank you for watching, and we'll see you next time.